Greetings, Eric Bakker, the naturopath. Let's talk about how to stop recurring bacterial vaginosis, or BV, something that I've written quite a bit about on yeastinfection.org. Also wrote quite a bit about this topic in my book, Candida Crusher, which was published in 2013. So this is an area of concern for many women. And over the many years I practiced, I saw countless cases of BV. So many women suffer from this condition. It's incredible. Many women, of course, get vaginal thrush. But we're talking more a yeast infection here. This is a bacterial problem, bacterial vaginosis. So vaginosis basically means inflammation of the vagina, and bacterial means it's a bacterial inflammatory condition. So many women find themselves in a never-ending cycle where they get these bacterial infections. They try one remedy, they try a cream or a pill, they go to the doctor, they get a bit of relief, but only for that infection to recur in a few weeks or a few months down the line. I've seen women who sometimes suffer from these infections for years and years on end. They go away, they come back, and it drives them crazy. How does this occur, this problem? I mean, how do you get this condition? Well, in a nutshell, BV, I'll call it BV for the sake of brevity, it occurs when the vaginal pH changes and allows harmful bacteria to thrive. So the vagina has an acidic kind of environment, but when this changes, it can allow opportunistic bacteria, just like yeasts, to really thrive and take off in this area. So symptoms can range from burning sensation when urinating, or fishy odors, abnormal discharge, itchiness or pain around the vaginal area. These are sort of all common symptoms. So the first step, which is very, very important, is to see a doctor. So it's very important that if this is recurring in a chronic condition, especially, you need to go and see one. So it's a very misdiagnosed condition, BV is. In fact, research shows that BV is probably misdiagnosed 60% of the time by, a lot of doctors. So this is mainly because the criteria used to diagnose BV are highly subjective, and the introduction of some natural factors can really skew this diagnosis towards a positive result. So for instance, the same fishy odor caused by VV can also be caused by a range of other conditions, ordinary day-to-day activities. So it's very important that you get professional assessment when this condition is chronic. Additionally, if you do contract bacterial vaginitis more than 2 or 3 times in less than 6 months, it's very important that you see a doctor. So this will help identify underlying issues that could be causing the recurrence of this problem. Plus also, it's just very important that you do this. So I've never for one have been a naturopath who says that everything can be cured, a word I don't tend to use much or like at all, but I do like patients often, or generally, seeing medical doctors and have the benefit of the natural and the medical science as well. So I think that's the sweet spot in my opinion. So let's talk about vaginal hygiene, right? So one of the best yet underrated steps you can take to stop these recurring vaginal infections is to maintain very good vaginal hygiene. Many women out there struggle with BV just because unknowingly they neglect their vaginal hygiene. Naturally, the vagina is a self-cleansing organism. A simple rinse with warm water is often enough. So this is why you ought to avoid douching or using any types of products inside your vagina. So be careful with scented or deodorizing vaginal products. These can be commonly used. So keeping pubic hair trim is very important with this condition, just as it is for guys with jock itch. I usually ask them to sort of, keep the pubic hair short because it stops heat building up in this area. It stops, a lot of mold and heat and all these things that can contribute to these infections taking off. Overgrown pubic hair just creates environments for bugs to thrive, really. I'm not saying that everyone should have short pubic hair. I'm just saying if you've got this problem, it's very good to keep it short. So, and the other thing, of course, which hopefully you don't need reminding of, is you need to wipe from front to back after having a pee or a bowel motion. And don't forget to change, tampons and liners and stuff like that. I mean, this is all really common sense, isn't it? Another way to maintain good vaginal hygiene is to maintain the vaginal pH within a normal range. Naturally, the vagina is slightly on the acidic side, so one of the ways to prevent it becoming too alkaline is using something that contains lactic acid. You can get some gels or stuff, but women can sometimes also benefit from using a little bit of natural sour Greek yogurt. You know, we're not talking stuff from the supermarket with sugar in it. We're talking the real sour stuff. Other women, of course, like to use a bit of apple cider vinegar in a bit of lukewarm water as a bit of a cleanse, because that's quite a nice, you know, acidic kind of a cleanse. Stop the alkalinity there. So breathable undies are a big thing these days, apparently. So let the vagina breathe. So remember, the choice of underwear can have a big impact on the health of the vagina as well. You want to avoid synthetic materials if you can, right, in your underclothing, especially stuff that's too tight or too synthetic. It's going to hold moisture there. Cotton's probably your best bet. But also think about gym shorts and leggings, which are often made from polyester or nylon kind of materials, you know. So you want to really go for natural fabrics like cotton that are breathable and lightweight and loose fitting. And at night, go full commando and let the vagina area breathe, you know. Regardless of the material, though, don't stay in damp underclothing. This includes wet bottoms and swimsuits. The moisture will build up in your underwear during the day. Consider using liners, you know, if you really have to keep it clean and dry. So the dry and cleanliness are big factors, you know, when it comes to BV. Safe sexual practices. Let's talk about that topic now. One of the most overlooked areas of BV is a safe sexual practice. When you think about it. So the research I've looked at, exposure to semen, for example, can lead to increased incidences of BV. So there's a whole bunch of safe practices you can adopt to stop the recurrence of BV. And of course, it all depends on the type of relationship you're in, you know, as well, of course. But condoms are a good way to reduce the likelihood of contracting BV. Secondly, also oral sex is a big one. So that can increase the risk of BV as well. Bacteria that come from the saliva can be introduced in the vagina and lead to flare-ups of harmful bacteria. So don't ever transit, of course, from the anal area to the vaginal area with intimacy without changing condoms. So the introduction of any fecal matter like E. coli into the vaginal area can be a huge catalyst for contracting BV, and is often one of the key reasons, you know, apart from poor hygiene and unsafe sexual practices, key areas of reasons why many women get BV. So consider this same advice when using any kind of sex toys and things like that. And sure stuff's, you know, if you're going to use it, it's going to be kept clean. You know, if you're going to use it from one area to another area, of course, you know, you need to clean things up. And again, it's common sense, isn't it? The other thing which experts, and you know, it's something I've always recommended, is for women to urinate straight after intimacy and rinse the vaginal and vulva area with clean water. So this will help to bring the pH back again, which gets disrupted during sex. Right? So lastly, it goes without saying that if you've got fewer sexual partners, you're going to lessen the risk of BV, which makes a lot of sense. So think about your risks, think about your hygiene, think about your clothing, think about the environment of the vagina, these areas, you know. So I've seen some really bad cases of BV clear up within 3 to 6 months when all the boxes were ticked. So probiotics are a really good thing to get into with BV. They can really help your gut and the vaginal area come back into their own. So probiotics not only help the body grow good bacteria, but they play a good role, an active role, in maintaining vaginal pH and preventing infections like BV. There's enough research now you can look up that will validate this statement. So this is because the beneficial bacteria found in probiotics, they can help to fight harmful bacteria and fungi like yeast, but also E. coli, bacteria that are common, you know, with BV. A recent clinical trial found that taking oral beneficial bacteria after antibiotic treatment for BV prevented reinfection. So, and of course, in my book and on my videos, you know, in my articles, you can read about, you know, why I'm a big fan of fermented foods, cultured foods. So natural probiotics like plain yogurt, fermented foods, kimchi, sauerkraut, miso, fermented vegetables, kombucha, if it's made properly, as well as some different types of cheeses like soft cheese or cottage cheese. So other alternative, of course, are over-the-counter probiotic supplements, and sometimes probiotic tampons some women use. So some women use yogurt and insert that, or partially freeze the yogurt, or, you know, or just roll tampon in yogurt and insert that. So it's a cooling effect that soothes and cools, you know, reduces pain, reduces itchiness, and be quite comfortable. You know, that's not a bad idea. Boric acid is something I've been recommending now for quite a long time, many years. I first heard about boric acid through a German doctor a long time ago when I was still a student, who said that it was quite used a lot during World War II, for example. And then when I started studying about yeast, I realized that boric acid was one of the key elements that helped a lot of my patients recover from seriously bad BV. One case particularly I remember was an airline lady that worked for American Airlines, or one of these aircraft companies, with seriously bad BV that affected her occupation. Now, this poor lady had this condition for a few years. The boric acid took it out, it cleaned it right up, which was such an incredible relief for this person. So this remains one of the most popular remedies now for bacterial vaginitis is boric acid. It's been used for a long time to treat fungi and to treat infections and molds, and it's not for internal use, of course, but vaginal use, it's perfectly fine to use. So, but there's not enough clinical research to fully endorse boric acid as a home remedy, but I can tell you from my experiences in the clinic, it's one of the best remedies you can use vaginally for seriously chronic BV, or just a chronic case. So you can get it over the counter. Pharmacies or chemists will often sell the powder. You can buy the capsules and fill capsules up and insert it vaginally. It can also be used as a suppository. You can also get vaginal suppositories from some companies that contain boric acid. So remember, it should never be ingested as it can lead to poisoning. And pregnant women, of course, avoid these kind of solutions or home remedies without, seeking a physician's advice. So change your lifestyle. This is a key thing with BV. Ultimately, your BV issues can be the result of your lifestyle. So studies have found correlation between high levels of the stress hormone cortisol and BV. As cortisol goes up, it starts affecting your immune response. White cell activity starts decreasing under high cortisol levels. When you're running away from a dinosaur, you don't need a powerful immune system, you just need a brain that's sharp-witted. So all these effects take place under stress, but unfortunately your immune system takes quite a beating, a heavy beating. So stress management activities, exercise, deep breathing, yoga, maybe some spa time. But also, of course, watch your diet and include healthy foods like garlic, onions, lean proteins, vegetables, fresh foods. Many of these have natural antibacterial properties. Ginger and garlic, for example, are excellent. Watch some of my more videos which I've produced on my channel regarding this. And of course, if you're looking for a unique medical solution without going an antibiotic way, you can consider Candida Restore. I released this now several years ago. It's an advanced probiotic enzyme. So it's actually enzymes and probiotics that contain 7 different enzymes and 6 probiotic strains. 18 billion CFUs, so 18 billion colony forming units. It's in a time-released capsule and it's shelf-stable for a long time. So this is a formula I developed after several years of research to look at the best strains I could find for conditions like BV. So what Restore does is it helps to support the eradication of yeast and fungal infections. It promotes the growth of healthy bacteria, which will crowd out some of the nasties. It provides relief from vaginal itching, burning and discharge, and improves your gut health. And it also supports a healthy digestive tract and a gut-related immunity. So really, it works to promote all-round vaginal health, which makes it a good solution, for this problem. So recurring bacterial vaginitis can have a big impact on the quality of your life, especially your intimate life. The good thing is, when you start using Candida Restore, it can really help you take back control of this area and of your life. So click on the link below now and find out more about how Candida Restore can help you stop recurring bacterial vaginitis. Thanks for tuning in. It's Eric Bakker, the naturopath from New Zealand.